It's not recording. Okay, welcome back to Nursing Education. I'm going to do my reflective questionnaire for this section of CNO Practice Standards, Therapeutic Nurse-Client Relationship. So the first question was, or is, what are the key principles presented in this material? And the key principles clearly are the 4 standard statements with indicators. So I'm going to say this. That describe a nurse's accountabilities in the nurse-client relationship. Although it does, these, I wouldn't say they're principles, but they're 5 components. But they're not the principles. These are the standard statements, which are the key principles. So how is my conduct inconsistent with these principles? Well, with the number 1, therapeutic communication, they made an unusual comment toward me in their written statement that did not match their verbal statement. So regarding romantic movies, why do they always end up together at the end? I answered because nobody will watch these movies if they don't end up together. And on the written statement, it did not reflect this. It said, they said in the written statement completely different words. We were meant to be together. Okay, so it was inconsistent. It was not my conduct, though. So this is not my conduct. That's their conduct. This is their conduct. So let's just say NA. Number 2, client-centered care. So how was I not consistent with this? Because I did not ask them their goals. I was lacking in this department. And I did not fully understand their abilities and limitations because I was not familiar with their past medical history and their history of behavior and their life experiences. And I don't know them that well, to be honest. Let's just be frank. F is a big one. It is their life experiences informed their worldview and possibly their opinion and perspective on having a male nurse, because they related only stories of them being abused physically, or I should say, physically and sexually by male figures in their life. So that is a big. I was not familiar. So I was not familiar with that. So I was not familiar with their life experiences. So that was my lack of knowledge. If I can say that. And seniors who seldomly receive visitors tend to be socially neglected, and they are lacking in social interaction, so naturally they are in need of meaningful social interaction. And so I don't see how it's inconsistent here, but that is a so that is more of a, I guess, number 4. So this is more number 3 or number 3 and 4 answer. And then the other one was, how can it be applied? Well, it was not my conduct. It's more there. So I'm going to say number 3 maybe. Number 3 answer. So how can these principles be applied? Okay, number 3, maintaining boundaries. I needed to let them know that I was going beyond the limits of appropriate time spent talking with them. J, so that's A. J is also a big one because I needed to consult with a manager or other colleagues whether what I was doing crossed a boundary, based on the client's past medical and life history, because they know them, they know her, they know the client better than I do. And would determine whether they could be trusted, or have any cultural I don't know, I want to say mental deficiencies and cultural cultural specific like if they had culturally specific potential problems that could arise from any misunderstandings or miscommunication related to culture, to differences in culture. So that, I think that's what it was. Like, if we're gonna be really honest, it was a cultural difference and misunderstanding. Okay, this is a big one because I don't know their culture and they don't know mine. So there was a cultural clash and a miscommunication, misunderstanding on both ends. And then this is a sub point of 3, giving and accepting gifts. It's not point 3, but it's a sub point. So I did not know whether this client was mentally competent, which led to them making false allegations based on impaired short-term memory and confabulation of stories and events that did not occur. For protecting the client from abuse, or remarks were made by the client toward the nurse that can be perceived as romantic, and this has to be, it's both ways, not just nurse to client, because romantically suggestive remarks that are made by the client can be perceived as inappropriate. And spending extra time socializing with the client, getting to know their life story, can be perceived as romantic because the discussion and topics were where them, client, sharing, choosing to share. That's the key point, choosing to share about their past relationships, unsolicited. So that is also, that can be a risk. Okay. And the decision tree. So how can these be applied to your practice? So 3. Question. How can this be applied? So I already talked about that a little bit, but the decision tree is really helpful because it is a key principle in ensuring misconduct will not occur in the future. In terms of whether a decision is meeting the client's needs and whether it is appropriate or not and professional. Or can be perceived as being unprofessional or crossing professional boundaries of the nurse-client therapeutic nurse-client relationship. So that's actually a really good answer, and it meets all those, checks all those boxes. So I did not inform my employer. That should be done in terms of my employer being the nursing home to perform this activity. So I'm going to omit that. Just put that omit. It's probably not a good answer to include. sounds like I need to ask for permission before I do anything. Warning signs of crossing a boundary. So I did spend extra time to socialize with them, with the client, that is, speak to them about their life experiences. And to maintain a quality practice setting, maybe I write that I shouldn't have asked for supervision to ensure boundaries were respected and maintained, but could be perceived as not being respected. Should I have asked for supervision? I don't know. I don't think that applies to the. I'm going to say omit that too, because it doesn't really apply to the principles. It's just something bonus. And then using these principles outline strategies for ensuring my misconduct will not occur in the future. So if I look at each one of these, starting with the therapeutic communication, they made an unusual comment to me, so that's their behavior, not me. Client-centered care, I didn't ask them what their goals were. It was lacking there, so I have to collaborate with them, with other professionals. How do I make sure I understand their abilities? Well, you can only become familiar with a client if you talk to somebody who is already familiar with them. So that would be a good idea. Who knows this client the best? I would have asked, who knows this client, who's well familiar with them, and then bring them with me as a second witness. So I was not familiar with my own lack of knowledge or life experiences, so how could I prevent that? Just don't get involved in those. If they start getting too personal, I would just say, okay, you know what, this is getting too personal. I sympathize with your experiences, but I should not spend extra time with you. This is going beyond what should be done. So I need to maintain boundaries professionally in terms of the time limit that is being spent with this person, with this client. What else? So cultural differences. How would I know this is a cultural difference? Well, I wouldn't know. I'd have to bring someone with me again to prevent misunderstandings and miscommunication from potentially arising. So I didn't know this person was mentally incompetent. So how would I prevent that? Well, again, bringing somebody with me. Remarks were made by them to me. And bringing another person. Spending extra time getting to know them can be perceived as romantic, so don't spend extra time with them. Again, although they chose to share those informations, personal, romantic kind of stories, I should not have entertained that. I think that's important. Don't entertain those types of discussions and just keep it professional, even though, people talk about those things, but I need to be aware of how it can be perceived, not only by other people, but even by the client. Like, it shows that I'm interested in that, and I'm really not. I'm just there because I'm sympathizing with them, but it can be misunderstood and perceived in the wrong way, so that should be avoided in the future. So in terms of the strategy of the decision tree, that's a very good one. How can that be outlined or used? It's very important to ensure misconduct will not occur, because if I'm making a decision to interact with a client, I have to make sure, is this meeting the client's needs? Am I putting them at risk? Is it appropriate and professional? Can be perceived as being such. If so, bring second witness that is a healthcare professional. So someone who is competent and trustworthy, which, to be honest, that's a challenge, even among colleagues. That is a colleague, ideally, not another client, because they both can be in cahoots, to be honest. So I spent extra time socializing with them, and that is a warning sign. So I need to be aware of these warning signs. So I need to be more aware of the warning signs if a boundary is being crossed or even being perceived by others, including the client, as a potential boundary being crossed, especially in light of cultural diversity and their personal life experiences that that vary from individual to individual. Yeah, so I leave it at that. Okay, so those are my answers for questionnaire number 2. And thank you for your time. We could just transcribe this. And so we've done part 1. So we only have a few more to go. I'm going to bed. I'm going to send my requests, my communications, and go to bed. It is now 6 a.m.